Starting part 4, objective 30, states, describe common physiological and maternal responses to pregnancy. In class, there should be small group discussions to discuss the adaptations and nurse interventions and education of various changes that occur in the GI that occur during pregnancy. For example, in the GI system, women who are pregnant are often very nauseated. So interventions that we can suggest as nurses include to have them eat some saltine crackers before getting out of bed, to eat small frequent meals, have those meals be bland, and also not to mix foods and fluids together. Each system needs to be looked at as to what you can educate the patient on doing for the common discomforts with pregnancy. It's not uncommon for, like in the reproductive system, the breast to feel full and tender. The good thing, the thing that we can do for that, or educate women to do, is to wear a good supportive bra of the appropriate size. Another thing that can happen is an increase in leukorrhea. When leukorrhea is increased, they may need to wear cotton underwear, and also they may have to require to use a little peri pad. The acidity of the vagina changes with pregnancy, which can allow for bacterial and yeast infections to grow. And so any abnormal vaginal discharge should be reported to the physician and evaluated. Again, there's an increase in the cardiovascular system. They may have palpitations and they may have a slight increase in blood pressure. There'll be changes in the respiratory system, the renal system, the GI system, and the musculoskeletal system, including the lordosis and the waddling from loosening of the ligaments. There'll be changes in the integumentary system, like the development of linea nigra and chylosma. They may have angiomas, which are spider nevi form. And again, they should have amenorrhea while they are pregnant. Objective 31 says review nutritional needs of a pregnant client. This is in page 245, which is chapter 12 in your book. And also it'll be in chapter 11 as well. The nutrient needs during pregnancy, really pregnant individuals only need about an additional 300 to 500 calories per day. It is important that they take their prenatal care vitamins so they get a good balanced nutrition. Folate and folic acid is important to prevent neural tube defects. And again, they need between 300 and 500 additional calories per day from protein and fruits and vegetables. They should increase their fluid intake to about 3 liters per day, and they should increase their iron consumption during pregnancy. With weight gain, there is a recommended weight gain during pregnancy, and is typically based on the BMI. Normal weight, which is a BMI of 19.8 to 26, those individuals should gain between 25 and 35 pounds during pregnancy. Underweight individuals with their BMI is less than 19.8 should gain between 28 and 40 pounds. Overweight individuals whose BMI is 26 to 29 should gain between 15 and 25 pounds. And women that are obese with a BMI greater than 29 should only gain about 15 pounds during pregnancy. Again, like I said previous, that twin pregnancy, they should gain between 35 and 45 pounds during that pregnancy. Individuals who are pregnant should avoid certain sweeteners like aspartame and saccharin, because we don't know if their unborn child will have the amino acids or the proteins to break down these sweeteners. Risk factors for nutritional deficits during pregnancy include adolescence. Adolescent girls typically do not eat very well. It's not uncommon for them to just drink Mountain Dew or not eat at all because they're fearful of gaining weight. If there's frequent pregnancies that are less than 2 years apart, can cause nutritional deficits in the individual who's pregnant. Poverty, poor diet habits, use of tobacco, alcohol and drug use, weight loss, eating disorders, multifetal pregnancy, and low hemoglobin and hematocrit levels all put the patient at risk for nutritional deficits. With this NCLEX style question, which of the following lunches would a nurse encourage for the pregnant woman? So you need to find something that is a good balance of protein and carbs and grains and milk products. Out of these options, the best one is D, cottage cheese, tossed salad, crackers, orange, and water, because it doesn't have any nitrates in it, nothing fried, and no caffeine. Objective 32, predict common nutritional risk factors and explain how they affect nutritional requirements during pregnancy. If the patient has too little folate or folic acid, the patient may have a fetus that's born with a neural tube defect. Pica is the practice of consuming non-food substances such as ice, chalk, rocks, and of course this could be detrimental to the health of both the mother and the child. Too little oral fluids such as water, milk, or decaffeinated tea can lead to constipation and dehydration. The increased level of aspartame can cause increased levels of phenylalanine or PKU to deposit in the fetal brain. And too little of iron it actually increases the risk of postpartum hemorrhage and preterm birth. And that's one of the first things labs I look at when I have a patient in labor is what her hemoglobin hematocrit is, and also her iron levels, red blood cell levels, because if those are all low for somebody who is pregnant, it does put them at risk for a postpartum hemorrhage. Maternal obesity is associated with perinatal morbidity or mortality from various causes, including complications during childbirth due to a large for gestational age infant or macrosomia. Macrosomia is defined as a baby greater than 8 pounds 13 ounces or 4,000 grams. It may cause prolonged labor. It may cause postpartum hemorrhage, poor wound healing because of the skin, excess skin, and adipose tissue. And they're also an increased risk for antepartum complications such as hypertension, preeclampsia, gestational diabetes, thromboembolism, and urinary tract infections. NCLEX sub question: which of the following should the nurse recognize as a desired weight gain during pregnancy for a woman of normal BMI? If you go back a slide or two, you would realize that this is A, 25 to 35 pounds. This table here is just some prenatal nutrition recommendations. Again, 2 cups of fruits per day, 2.5 to 3 cups of vegetables per day, 3 servings of dairy products per day, 3 2-ounce servings of meats, poultry, fish, eggs, dried beans or nuts, and 6 servings of grains, as well as making sure they are drinking enough water per day.